Labor and delivery, commonly referred to as childbirth, is a natural physiological process through which a baby is brought into the world after completing its development in the mother's womb. It is considered one of the most significant and transformative experiences in human life, both biologically and emotionally. The process of childbirth is not only about the delivery of a baby, but also about the immense physical and psychological changes that occur in a woman's body. Labor typically begins around the 37th to 42nd week of pregnancy, although it can occur earlier in cases of preterm labor. The onset of labor is marked by a series of contractions in the uterus, which gradually increase in intensity and frequency, helping the cervix dilate and the baby move into the birth canal. For centuries, childbirth has been both a natural phenomenon and a medical concern, as it involves risks to both the mother and the newborn. Modern medicine, however, has significantly improved maternal and infant survival rates through better healthcare facilities, trained professionals, and advanced medical interventions. Despite these advancements, labor and delivery remain highly individual experiences, as every pregnancy is unique and every mother undergoes a different journey. The importance of understanding labor lies not only in appreciating the biological process, but also in recognizing the emotional, cultural, and social dimensions attached to it. In many societies, childbirth is celebrated as a major milestone, often accompanied by rituals and traditions that emphasize the arrival of new life. Therefore, labor and delivery stand as a universal human experience that bridges the biological process of reproduction with the cultural celebration of family and continuity of stages of labor. The process of labor is generally divided into three main stages, each with distinct characteristics and challenges. The first stage begins with the onset of true labor contractions and continues until the cervix is fully dilated to about 10 centimeters. This stage itself has two phases, the latent phase and the active phase. In the latent phase, contractions are mild and irregular, gradually increasing in strength, while the cervix dilates slowly. During the active phase, contractions become stronger, longer, and more frequent, leading to rapid cervical dilation and intense discomfort. The second stage of labor begins once the cervix is fully dilated and ends with the delivery of the baby. This stage involves active pushing by the mother along with the uterine contractions to help the baby pass through the birth canal. It is usually the most physically demanding phase, as the mother exerts significant effort to bring the baby into the world. The third stage of labor begins after the baby is born and continues until the placenta, commonly referred to as the afterbirth, is expelled from the uterus. This stage is crucial because improper expulsion of the placenta can lead to severe complications, such as postpartum hemorrhage. Each stage of labor requires close monitoring by healthcare professionals to ensure the safety of both mother and baby. Pain management techniques, such as epidural anesthesia, breathing exercises, and relaxation methods, are often employed during these stages to provide comfort and reduce stress. Understanding these stages is vital not only for expectant mothers, but also for families and caregivers, as it prepares them for the reality of childbirth and helps them provide the necessary support. Methods of delivery childbirth can occur through different methods, the most common being vaginal delivery and cesarean section, C-section. Vaginal delivery is the natural process where the baby is born through the birth canal after the cervix is fully dilated and the mother pushes in coordination with uterine contractions. It is generally considered the safest and most preferred method when there are no medical complications. Vaginal births are associated with shorter recovery times, lower risks of infection, and fewer complications for both mother and child in most cases. However, when complications arise, such as prolonged labor, fetal distress, abnormal positioning of the baby, or maternal health risks, doctors may recommend a cesarean section. A C-section is a surgical procedure in which the baby is delivered through an incision made in the mother's abdomen and uterus. Although C-sections can be life-saving, they are associated with longer recovery periods, increased risks of infection, and higher medical costs. In addition to these two primary methods, there are also assisted vaginal deliveries, where tools like forceps or vacuum extractors are used to aid the process when labor becomes difficult. Natural childbirth, without medical interventions, is also a chosen option for some women, particularly those who wish to have a holistic birthing experience with minimal medical interference. The choice of delivery method depends on various factors, including the health of the mother and baby, medical advice, and sometimes personal preferences. With advancements in modern medicine, women today have more access to safe and flexible birthing options, but each method still carries its own benefits, risks, and emotional implications. Physical and emotional experiences, labor and delivery, are not only physically intense, but also emotionally overwhelming experiences for mothers and families. Physically, women go through immense pain, exhaustion, and hormonal changes as their bodies prepare to give birth. Pain during childbirth varies from woman to woman, depending on factors such as the baby's position, the strength of contractions, and the mother's pain tolerance. While medical interventions like epidurals can ease physical discomfort, emotional factors such as fear, anxiety, and anticipation often play a major role in shaping the childbirth experience. For many women, childbirth is an empowering experience that brings a sense of strength, accomplishment, and fulfillment. However, for others, it may be associated with trauma, especially in cases of prolonged labor, emergency interventions, or unexpected complications. The role of emotional support during labor is crucial, as having a partner, family member, or doula present can provide reassurance, encouragement, and comfort. Furthermore, cultural and religious beliefs often influence how childbirth is perceived and experienced. In many cultures, childbirth is considered a sacred event, celebrated with rituals, prayers, and traditional practices. After delivery, the mother may also face challenges such as postpartum depression, anxiety, or stress due to hormonal shifts and the responsibilities of caring for a newborn. Therefore, emotional support, counseling, and awareness are essential in ensuring a positive childbirth experience. Understanding the physical and emotional dimensions of labor and delivery helps society appreciate the strength of mothers and recognize the importance of providing them with comprehensive medical and emotional care during this critical phase of life. Conclusion and significance of childbirth. In conclusion, labor and delivery are complex processes that combine the biological function of reproduction with profound emotional, social, and cultural significance. The stages of labor, methods of delivery, and the physical and emotional experiences of mothers highlight the multifaceted nature of childbirth. It is not merely a medical event, but a life-changing milestone that marks the beginning of a new chapter for families. Modern healthcare systems have made childbirth safer and more manageable, yet it remains a deeply personal experience, shaped by the unique journey of each mother. The importance of proper medical care, emotional support, and cultural sensitivity during childbirth cannot be overstated. Every birth, whether through natural delivery or surgical intervention, represents the miracle of life and the resilience of women. Moreover, childbirth reflects the continuation of humanity, connecting generations through the arrival of new life. By understanding labor and delivery in depth, society can better support mothers, reduce maternal and infant mortality, and celebrate childbirth not only as a biological necessity, but also as a moment of joy, strength, and unity. Ultimately, labor and delivery remind us of the extraordinary